Okay, so we'll start. I welcome you, Dr. Akarsh Singh, who has scored a rank of 62 in May INICET 2023. He is a MBBS from SN Medical College, Agra, and he's also scored an amazing rank of 285 in NEET PG.
Yes, sir.
And he is a pre-foundation student with us from second year. And he is currently a post-intern. So I welcome Dr.
Yes, sir.
Akarsh.
Thank you, sir.
Congratulations on great
Yes,
rank.
sir. Thank you, sir.
कैसा लग रहा है?
सर बहुत अच्छा लग रहा है सर. फाइनली जो एम था अंडर 100 रैंक लाने का सर वो फाइनली पूरा हुआ. So I have been trying since November INICET. So in that also sir, I got a decent rank, but then I worked harder, and after NEET sir, in these 2 months I have put in all my efforts and thinking that it would be the last exam that I gave. So I'm so very happy with the results.
हाँ, मतलब नीट के बाद तो आपको ये तो पता ही था कि ये प्रैक्टिकली लास्ट ही एग्जाम है, क्योंकि अब नीट में तो यू आर गेटिंग एवरीथिंग. So the first thing that I would like to know is that when you got such a great rank in NEET, then how did you motivate yourself to then keep studying for INI? Because you are a post intern. With interns, I feel it is easier because they are like कि हाँ हमें तो internship चल ही रही है, तो ठीक है थोड़ा बहुत पढ़ भी लेंगे, because their journey is still going on ना.
Yes, sir.
You being a post intern, how did you manage with that thing कि अब तो मुझे मिल गया जो चाहिए था?
सर इन बिटवीन सर ऐसा लगा था कि हाँ मिल जाएगा, लेकिन सर टू बी वेरी ऑनेस्ट आई वाजंट रियली हैप्पी विथ माय रैंक. आई ऑलवेज सर बिकॉज इन द नवंबर INICET I got a rank of 279. Okay. And then in NEET I got 485. Okay. So sir that was kind of downgrade for me. So it even pushed me harder to like work for it and get a better rank in two months. So I was thinking maybe it will improve in NEET from the past November INICET. And so we didn't get to give the last year NEET also. So because our internship was delayed. It ended in August. So we didn't get the May INICET or NEET. So my first exam was November INICET last year.
Okay, so but you had kind of you had already made up your mind ki, okay, this is what I want under 100 rank in the national.
Yes, sir. Yes,
that is wonderful. That is a very good level of confidence, I must say, because November was the first exam you gave. Yes, your preparation must have been amazing. So just take us through your journey of right from the time you decided that you want to prepare till the time you finally did it.
So in our college, most of the people join DAMS in the second year only. So, but then we were at that time we were very casual, like making notes in classes, attending the classes, not worrying much about reading them. We used to read standard books also alongside, but the notes always like held in between. Some topics used to cover from the notes. And so after that, so in third year, during the lockdown, so at that time, I believe most of the people lagged, but for me, it was like the golden opportunity. So when we got the recorded videos online, so because I like watching it at a fast pace, so I used to cover more of the things. And so one thing is that so the daily quiz, which most people don't think. So it started around third year until now, so it's around 11,000 modules of daily 5 questions. So it kind of gave me an edge in like cracking new questions every day, because till then I wasn't really prepared much, but still it gave me a knack of like solving even the tougher MCQs, daily questions. So then I made my complete notes around third year and some notes in fourth year also. So first, second year I did in my internship only the notes, and so then I revised it once till August, and so in 2 months I like gave weekly GTs and thoroughly revised the GTs. So my rank drastically improved in these 2 months only before November INICET. So till after that, sir, I was kind of relaxed for 2 months in the counseling session and on. So then I started preparing again in mid-January around for NEET. So I kind of got delayed in that, but I still believe that with the rank I got in NEET, it pushed me harder for the next 2 months to like work for INICET also. Because getting an AIIMS was my dream always since second year.
बहुत बढ़िया. So you sound like somebody who is like a perfect planner, because what you said is something that, of course, all these courses that we have designed, we ultimately want students to follow this pattern but I'm very happy and also surprised that I have finally found somebody who has done this just the way we wanted them to do. And that is, this is, your result is talking about it.
So especially the T&D, sir. So I believe it was like really close to the paper, sir. DAMS T&Ds. So they are like very good. The exact questions, I believe, some of the questions I found exact repeats from the T&D from me, INICET. And so even the GTs, the last mock GTs of INICET, sir, with the video solutions, so they were really helpful for this paper. So I revised mostly the questions only of the T&Ds and bookmarks I had made, and that was my revision source for the last days. I didn't even get to complete the DBT this time. I completed in the NEET, but not this time, sir. Okay. Only few subjects I did.
But you concentrated more on giving tests and analyzing your tests in the last
yes,
months. That is wonderful. Achha, this how would you characterize this INICET exam? Was it easy or was it difficult?
So it was like moderately tough exam. So because of many out of the box outlier questions, around 9 or 10 questions were like not doable, but still I attempted like 4 or 5 to them. And so I found this exam very close to the GTs, unlike November INICET. And November INICET, I was like, what is this? Like, it's completely different from the GTs. Maybe because I haven't given that much GTs till then. But now, sir, I believe it was like set pattern, like micro questions, patho questions, same fungi, parasito, and everything. So it was like direct. I found it like repetitive. So because I focused most on PYQ.
This is also a trend actually. November INICET is a lot of PYQs and related topics, but May is always something new. And when we make GTs, then we always try to include newer things in it because we want to give a true exam feel. मैंने जो पढ़ाया अगर मैंने उसी से GT बना दिया तो आपको लगेगा हाँ मुझे तो सब आता है, बट GT देने के बाद there is always this fire that comes inside कि यार अभी और करना पड़ेगा, maybe we are not enough, नहीं तो अपने ही DAMS का पढ़ा GT क्यों नहीं हो रहा?
Yes sir.
So that is always there. That is nice.
So even the CBTs also. So there are very good analysis for your actual rank that makes in the exam. CBTs.
So you do believe a lot in exam preparation by giving tests.
Yes sir. Yes, sir.
That is actually something which we also say कि ultimately वो जो भी application है, whatever you are reading, has to be in MCQ. So if you are not reading MCQs, you are not doing them more often, then you tend to get away from the whole field.
Yes, sir. And sometimes, when we lack the motivation to read notes again, go through them again. So at that time, though MCQs which you did wrong, they motivate you to like read those topics again and like go on with it.
The retrograde type of revision.
Yes, sir.
Do the test, whatever is wrong, go back to the topic and only read that topic.
And so rather than passively reading, you read it actively.
Yes.
Because when you do your mistakes and read it again, it sticks to your mind for a long time.
Because our perception says कि शायद हमको ये याद नहीं है, but actually जब क्वेश्चन करते तो realize करते कुछ और ही याद नहीं था. ये तो हमको जो लग रहा था हमें याद नहीं है, वो तो हमको याद ही था.
Yes, sir.
So how was your approach in the exam? Like when you started, you would have felt कि ये थोड़ा सा on the tougher side है. So did you change your strategy in terms of number of attempts and negatives and?
So in the November INICET, I learned that I under attempted the questions at that time. I did around 182 questions, and so after that, it was like in my mind that I have to go all out because I want the top 100 rank. So I have to do minimum 190 plus questions. So I attempted around 195 questions. 5 questions I left because they were really out of the box. I think everyone left those questions. I assessed the paper while giving it like these questions nobody can do. So I better to
you have attempted the maximum amongst the students I spoke to. Maximum attempted in the range of 188 to 190.
Okay,
so yes, for you I think 5 were out of the box, but for most of even the top 50 ranks, most of them they felt around 15 questions were totally out of the box.
Yes, sir. Yes, sir.
But then also you must have realized this thing, or you must have rehearsed it while you did your GT कि ये 15 question they don't make a difference in your rank.
Yes, sir.
ना तो ये selection
everyone's
rank में
those questions.
But then ultimately what happens is later on most of the students they focus a lot on these topics which are outliers like you said, और bulk को वो भूल जाते हैं. The 185
that is not needed. Sir, जितना कम सर उतना अच्छा है. जितना कम आप जितना concise कर लो.
जितना
The
करता
end के time पे I couldn't even revise DVT. I could
हाँ
only do the bookmarks and some part of the DVT. I
हाँ
couldn't revise it completely. So it's a lot. If you keep gathering stuff, it isn't gonna help you.
yeah, it's unending.
Yes, sir.
And how did you, like, you started in second year and you were predominantly an online student?
Yes,
because yes, you are from Agra, so in Agra we don't have a offline.
Yes, sir.
So tell me, how did you cope up with this FOMO of the excess material that is out there, in terms of whether it is being distributed on telegrams or your friends coming and telling you, and you also must have a lot of friends who must be having a lot of other material. So how did you decide कि अब मुझे तो बस ये करना है, या मैंने decide कर लिया है कि ये अच्छा है?
Sir, sir, it's basically trust on DAMS, sir. I didn't like bother much about other things because whenever I solved questions, most of the things were in my notes only and in a proper algorithm manner, not just like rote learning. Sir, so तभी से sir, I developed trust on DAMS, sir, and then I
तो
just stick to it.
मतलब एक चीज तो पक्की है कि आप कहीं से भी कुछ भी पढ़ो,
Yes, sir.
अल्टीमेटली इंपॉर्टेंट ये है कि आपको उस पर ट्रस्ट होना चाहिए.
Yes, sir.
है ना? बिकॉज यू कांट कीप ऑन बस गोइंग फ्रॉम वन सोर्स टू अनदर. It has to be something that you believe in and then you stick to it, you know?
Yes, sir.
Yeah, that is
And
actually
the way the
nice.
teachers teach, sir, it's like I didn't find it anywhere else, sir. It was like the concepts were so clear, sir, after attending the classes. And then, sir, even sir, with the online videos also, I could like rewatch it again. Some things I missed, so that I used to do. Not hesitate like reading the notes again. I used to watch the videos, make my concepts clear first. So that's why, sir, I took around a complete like full year in my first grade. So that was kind of late, but I like made my foundation very strong. So after that, in 2 months also, sir, I was able to revise these things.
Revise them, yes. Yeah. But ultimately, what you are saying is absolutely correct. Ultimately, it doesn't make a difference if the end result is what you are getting. Yes, so sir. Even if you spend, say, a little more time as compared to someone else, but what matters is कि जो काम किया वो सही किया, और वो सही काम करने की वजह से आपको जो रिजल्ट मिला, तो that is far more better.
Yes.
Nice, nice. So अब क्या प्लान है आगे? What are you planning to opt?
The medicine, radio and surgery, sir. I am still confused in these three branches, but sir, I'll decide whatever college and whatever branch is.
Medicine and surgery, दोनों में कैसे confuse हो गया तू?
Sir, I want a core branch, sir, basically, so that's why.
तो फिर रेडियो में क्यों confused है?
सर रेडियो में सर थोड़ा लगता है कि सर थोड़ा एमडी के बाद भी you can like decide whether you want to do a DM or not. So, but in medicine or surgery, it's like you have to do something else after that.
Acha.
That's why. So I'm still deciding on it. So there's like 1 month left. So I'll make up my mind. So, but basically, so medicine is like the top.
Medicine is what you originally want.
Yes, sir.
Okay, that is always a good choice. Core clinical fields का अपना एक feel भी होता है, वो मतलब वो irreplaceable होता है with any other thing.
Yes, sir.
So yes, if you feel that you are a pro medicine person, then yes, you should go ahead with medicine. That is a very nice decision.
I always wanted to be a cardiologist. So
yeah, most of them they do, but we'll see about that, because once you do medicine, then a lot of factors they change. I often say this thing: super speciality is to be decided only at the end of speciality. वो कुछ लोग होते हैं जो 6-7 ईयर कोर्स कर लेते हैं, जिनको बहुत विजन होता है कि हमको न्यूरोसर्जन ही बनना है या प्लास्टिक ही बनना है, बट अल्टीमेटली आई एम टेलिंग यू, you get the real feel of a specialty when you actually work in it. तो आपको भी बाहर से ऐसा लगता है कि cardiology is something that excites you, but who knows what happens 3 years down the line? Maybe something else starts to excite you better.
Yes, sir.
So yeah, that is an open mind that one has to keep always.
Yes, sir.
Nice. Anything else? Any last word of advice you want to give to people?
I would like to tell everyone to keep a good friend circle also, sir. That motivates you. So my friends like Dakshita, Shravan, Sunny, Veronica, Mitra, Nikhil, so all of them had likes, and whoever I'm missing, I'm sorry, I could name a few. And so my parents, so they always like gave their time, precious time on my studies, and like whenever I used to say that I have to study, they just kept everything aside, and so let me do that. So yeah, that friend circle thing is very important. So we used to discuss now. So where we are lacking, which part, what to do, how to manage the time and everything. So that really helps.
So support system is very, very important.
Yes, sir.
One should not try to do this all alone. क्योंकि यूजुअली आई थिंक अप्स एंड डाउन्स तो सभी को आते हैं,
Yes,
तो
sir.
डाउन्स में एक सर्कल होना, एक एंटोराज होना,
Yes,
इट
sir.
मेक्स
It
इट
it becomes very monotonous over a time. Yes, sir. And always to like actively read your notes, not passively read. So that makes a difference. So many people read it like thrice or 4 times or 5 times. So it doesn't make a difference if you're just cramming through it. Like actively revising is like what makes you good in ruling out 2 options or that thing.
That is a very very nice thing. कि बस rote learning नहीं करनी है कि बस पन्ने पलट रहे हैं. You have to actually make sense and apply it in an MCQ.
Yes.
So Akarsh, it was wonderful talking to you. You are
Thank you, sir.
Very bright young man. Very impressed by your cool approach. अभी ये पूरे इंटरव्यू में भी तू एकदम cool बैठा है, as if ये just a next thing that you are doing, but it is actually an exemplary result. And especially what I liked about you is that despite of being a dropper, you had that vision कि सिर्फ select नहीं होना है, 100 select होना है.
Yes,
so that is something that usually I see this kind of statements from people who are with internship, who are doing, but you being that thing, I feel it motivated you to kept on doing and doing and doing, yes, and finally you have achieved your target. So ultimately making a goal is also very very important.
Yes.
So it was very nice talking to you, Akarsh.
Thank you, sir.
All the very best for your future. Stay in touch. Okay.
Thank you, sir.
Okay. Bye, buddy. Bye.
Bye, sir.